We're very excited for the team that we have presenting tonight. We're going to talk in depth to make sure that you guys have the right health information that's completely accessible. So you guys have equal access to good health information. We will be setting up future talks on the 4th Tuesday at 8 p.m. regularly. So please put it in your calendar and save the date. We'll have a variety of topics coming up. So I want to go ahead and review who's going to be here tonight. I really want to thank Noah Kim. She's our communications expert. She's set up all of the technology and the Facebook Live. So we really appreciate everything she's done to make tonight happen. There's other people as well. We have Kayla Helm, who's been very instrumental in this process, and Samantha Radakanda. They're both on the research staff here. So I'm really, really glad that they're on board with this. I also want to thank James Check, who's going to be our interpreter tonight. He's also an interpreter at Michigan Medicine, so thank you to him. And we also have a CART transcriptionist, Kate Miller. And so really you can see we've got lots of things set up to make this truly accessible. This will also be recorded if people want to watch it later. We'll be sharing some resources with you throughout the evening, throughout our 1-hour presentation. So check the comments for that. Some of that will be in ASL, some of that will be video, some of that will be in condensed English. The point is to get accessible, clear information out to our community. It would also really help us if you would fill out a survey. We're going to have 2 surveys that we share with you. One of them is related to communication access for deaf and hard of hearing mothers during pregnancy. They don't have to be pregnant at this time. They could have been pregnant in the past. And then also with COVID and how it's impacted their life. The second survey is for anyone, and it relates to accessing information during the COVID pandemic. So please keep an eye out and fill out those surveys for us. Very excited to talk about our presenters tonight. We have Sarah Hein. She's a deaf nurse practitioner in Michigan. So we're really grateful that she's joined us because she has a lot of experience. She's actually already been giving out the vaccine to different patients. So she'll go into depth about the vaccine, what the shot will look like, and the timeline and what you can expect. We're also really grateful to have Nigel Howard with us. He's one of a very, very well-known certified deaf interpreter from Canada, and he'll clarify, really go into depth to explain more about COVID, the vaccine, and also what you can expect. So let's go ahead and get started. I do want to take a moment and just recognize the traumatic impact that COVID-19 has had in our lives. It's really sad that over 400,000 people have passed away in America. And it's very important that we keep our dedication and working together, strategize on how we can reduce its effect and also overcome this experience. There are some key things like washing your hands regularly, wearing a mask, and maintaining social distancing. These are measures that we really have to continue to have in place. But we do now have a 4th measure, which we're going to talk about tonight, which is the COVID-19 vaccine. Just in December, there was emergency approval from the FDA for 2 vaccines. Pfizer is a company that makes one, and the other one is made by the company Moderna. So I'll refer to them as P and M for this point on. They were both approved, but there'll be more information on that later. The technology is very impressive behind these vaccines. And really, we don't have to be nervous or uncomfortable with what's inside them. They are going to be very useful with stemming the spread of the COVID-19 virus. There are over 18 million people who've had confirmed illness, and maybe others that we don't know about. So you can just see how quickly this virus has spread. So I want to talk about both vaccines, both Pfizer and Moderna, how they work. And they do not function the way that vaccines have functioned in the past. In the past, there's pieces of the virus, or maybe an inoculate virus, a dead virus that's in the vaccine. There are no virus in this vaccine at all. In the past, it's been a concern that you would be able to get the virus if the weak virus or a virus that was injected into you. But since there's no virus in here, there's no way to contract or spread the virus from the vaccine. So our mRNA, which is part of the genetic properties in this, will trigger the cell to make antibodies, but it doesn't actually enter into your cell. It's completely safe. It doesn't become part of your body at all. What mRNA does is that it's encoded genetic material with the virus genetic code. And then that is what's mixed together in part of the solution and injected into you. So when the mRNA is introduced into your cell goes forward and makes protein based on the mRNA. And what that does is it matches the shape of the virus. And so what it is, it's able to attach itself to any virus that does enter into your body. So if you get exposed to the virus, your body will recognize the virus and mount a defense against it. Those are called antibodies, that first line of defense from the virus. So if you're exposed to a person, or if I were exposed to a person and I've already had the vaccine, my body is already ready to mount a defense against the virus as it introduces itself into my body, because I've already prepped my body to recognize it. And those antibodies remain inside of you. We suspect that it will last at least 2 years, 1 to 2 years, but we're not sure how much further beyond that. It still needs more study. And it's not just a one-time shot for the vaccine. When you get a Pfizer shot, you have to wait 21 days. And the 21 days kind of helps your body to build the defense that it needs to build. And then you have a second shot. So there's 35 days from beginning to end for the vaccine to be able to build its immunity effectively. The Moderna vaccine functions a little bit differently. You get your first shot, and then you'll get your second shot 28 days later, so roughly a month after your first shot. And then even after the second shot, you have to wait another 14 days for full immunity for your body to build those antibodies. So you can see there's quite a bit of time for those shots to work together and your body to build up that defense. They're currently going through clinical trials to make sure that they're good quality vaccines. So scientists administer the vaccine to different control groups. There are 43,000 people who were part of the original clinical trial. So it wasn't just a few people. 43,000 people last year were given the COVID-19 vaccine. Some people were given the real vaccine, and other people were just given an injection that was not the vaccine. They didn't know which one they received. And so they were able to follow those people and see whether or not the vaccine was successful or not. Those who didn't receive the vaccine still got sick when they were exposed to the virus. Those who did get the actual vaccine, only 8 people got sick. So 95% of the people who received the vaccine were able to successfully prevent themselves from getting sick. So about 60 to 70, wasn't 60 or 70% effective, it was 95% effective, which is really encouraging. Moderna, now they'll be going through more trials with 30,000 people, 15,000 people getting the actual vaccine and 15,000 people getting a shot, but not the actual vaccine. Again, not knowing which shot they're actually getting. So of those people who got the vaccine for Moderna, 11 people got sick. So I think what they didn't get, it was 162 people in the control group did get sick. So it was a 94% effective with protecting against COVID-19 for the Moderna vaccine. So Pfizer can only be administered to those aged 16 years of age or older. And for the Moderna, it's 18 years of age or older. They are currently going through trials with those who are younger than those age, and hopefully we'll be able to administer them to the kids in the future. But at this time, they're not approved for children. There's not enough vaccine right now available for everyone, unfortunately. And I know that it's a struggle to get them, but hopefully it'll be much easier as we go along. At this point in time, there's not enough for everybody. Michigan Medicine is taking the approach of focusing on those who are age 65 and older because they fall into the high risk category. Once everyone in that category has been vaccinated, they'll focus on those with other factors like diabetes, comorbidities, other illnesses that put them in high risk. And then after that group, it'll be more available for everybody. So it will take some time before most people will be vaccinated. Probably sometime during the summer, everybody who wants a vaccine will be able to get one. If you're curious about where you can get a vaccine, it's important to contact your health provider, whether or not that's a hospital system or doctor, maybe your county health department. And you can reach out to them and see where you can register to get the vaccine, even though it will take some time. Many vaccines right now are given on a random lottery basis. So that's another thing to consider if you're not picked, even if you're in that category. I want to be able to get through my information pretty quickly. That way we can get to the other presenters tonight. So what about getting your vaccine if you've already had COVID? I do recommend that you still get a vaccine. The reason is that you could develop antibodies after having already been sick with COVID, but sometimes your body doesn't develop antibodies. Really, the more serious illnesses that result from contracting this disease are so overwhelming to your immune system that they don't develop antibodies. If you get a very light case of COVID-19, your body then is able to mount a defense, but that's not always how it happens. And if your body doesn't have enough antibodies, you could contract COVID-19 again. It's important to remember, though, that it is a safe vaccine. It's sodium and sugar mixed with the chemical. There's no mercury in it. It's a remarkably safe and healthy vaccine. It just is chemicals with the mRNA. So if you're worried about having an allergic reaction, like let's say you have a pollen allergy or you're allergic to different foods, you should be okay. Just let your providers know if you've ever had a very serious reaction, like anaphylactic shock. That would be an important thing to tell your healthcare provider before getting the vaccine. Or when you go to get the vaccine, explain to the person who's administered to you. There are other things that we'll go through tonight about how you can prepare to get the shot. Just remember, you will need 2 shots to complete the dosage for the Pfizer, and then you'll have to wait 14 days after getting the second shot for Pfizer for full immunity to develop in your body. Now, once you have your vaccine, you still need to continue to wear a mask, wash your hands, and socially distance, because there are other people who will still be at risk. And so until the pandemic is really under control, it's measures we need to keep in place. You may have heard of a term called herd immunity. And I like to describe it like this. If you have a lineup of people and no one's had it before, it's very, very fast for that virus to spread from person to person. If everyone's received a vaccine, then they're already resistant to it. So the virus will then try to find the next person who hadn't either received the vaccine or hasn't been sick. Then you reach a certain level, which, for example, would be 80% of the United States having resistance to the virus, then that means we've got herd immunity and we're resistant. So, for example, if you have that lineup of people, and 8 of those 10 people have already been sick or have had the vaccine, the virus won't be able to find a host and then therefore dies. So when you get the opportunity, please take it and get the vaccine. Please don't put it off and get it as soon as possible. If you are able to get it and it's available, it'll help us all in America get back to normal as soon as possible. So right now I'm going to turn it over to Sarah Hein, and she's going to talk a little bit more about the vaccine, some of her recommendations, and what you can do to prepare. So Sarah, take it away.
Hello, my name is Sarah Hein. I am choosing to keep my camera off at this time because I want to focus on the interpreter so that everybody can see sign language well and everything is accessible. I will pop up at the end when we do the question and answer section. Okay, so I'm going to talk about the overview of the visit when you get the vaccine. So before your visit, you probably would like to talk to your doctor, your PA, or your nurse practitioner, and just discuss your health history with them. Make sure that they feel okay with you getting the vaccine, especially if you have chronic conditions like diabetes or heart disease or anything like that. Also, if you're pregnant or breastfeeding, you probably want to talk to your OB and make sure that your OB is okay with you getting the vaccine as well. Other things that you want to think about before you get the vaccine are allergies. So as Dr. McKee mentioned, if you have prior serious reaction to vaccines or other drugs or food or anything like that, that's something important that you want to share with the healthcare team when you get your vaccine. Another thing that you want to mention when you go for your visit is if you're taking a blood thinner or you have a blood disease, because obviously when you're getting a shot, you might bleed a little bit from a shot. So when you're taking a blood thinner, you might bleed a little bit more. So it's important to know if you might bleed. You want to check with your doctor if you're immunocompromised as well. Like say you have cancer, so you probably want to talk to your oncologist before you go for your visit. One thing that you can do for yourself is to read about the vaccine or attend presentations like this so that you're well aware of what the vaccine is and what happens at the visit. There's a lot of information on the CDC website, the state of Michigan website, and both of the vaccines have websites as well, and you can check on those. One more thing I want to mention before you do your visit is make sure you don't take ibuprofen or Tylenol before the vaccine because that can decrease the effectiveness of the vaccine. If you had a serious reaction in the past to anything like a vaccine or a medication, you can bring your EpiPen with you and you can bring Benadryl as well. I know that we're all deaf and hard of hearing and we have questions about access. So when you sign up for your appointment, please call the office or check on the website to see what kind of accommodations that they give to us. Some of them have clear masks. Some of them they write on whiteboards. Some of them have ERIs. So it's a good idea to ask what your state does before you go to the visit. You can also take clear masks with you or a whiteboard with you just in case they don't have what you need. When you go to the visit, they will check you in at the desk. Then you will go back with a nurse practitioner, or a medical assistant. They will ask you about your health history. They will ask you about your allergy. They are doing all this just to make sure that everything is documented and they know kind of your history and what's going on with you. They will also ask which arm you want to use. It doesn't. I don't believe it matters what arm you use. It's a personal preference. When I give a vaccine, I usually ask what hand you write with, or the other one that I ask is what arm you sleep on. Because if you get the vaccine and the arm you sleep on, and then your arm hurts, then you're gonna be waking up at night. Another thing that they might do during the visit is schedule your next appointment. So I recommend taking your planner or your phone that has your schedule so you know when you can go to your next appointment. You can probably ask about accommodations for the next appointment just so that it's planned ahead. When you get the vaccine, it is going to go into your muscles. If you remember where you got your flu shot, it's going to be in the same spot. After you get the vaccine, you will be monitored for 15 to 30 minutes. The timing depends on if, for example, if you had anaphylaxis in the past to some kind of medication, then we're going to want to monitor you longer. If you're just a normal person with normal health history, then you'll probably just sit there for 15 minutes. While you're being monitored, if you're feeling sick at all, if you feel lightheaded, or if you feel like your heart racing or anything like that, you need to raise your hand and wave down any of the staff and let them know that you need help. And they will come and help you. Okay? Next, I want to talk about some of the side effects and reactions that you might have. So the most common side effects are pain at the site where you got the shot, feeling very tired, and a headache. And then the least common side effects are muscle pain, chills, joint pain, fever, nausea, and swollen lymph nodes. If you happen to have a severe allergic reaction to the vaccine, you will have difficulty breathing, swelling of the face and throat, a fast heartbeat, bad rash all over the body, dizziness, and weakness. Usually, with the severe allergic reactions, they occur right away, and during the monitoring period that I talked about previously, that would be the good time to raise your hand and let people know that something is happening. At my site, we are very responsive to people that are not feeling well, even if it's just anxiety. We will call the EMT and we can take them to the hospital if they need to go. In my experience, I have seen very few reactions. I have seen many people do just fine. Also, I want to note that after the first vaccine, you usually don't have very many side effects. After the second vaccine, you might experience more side effects. But I cannot predict what all of you might have because all of our bodies are different. So it depends on what your body does to how you react to this vaccine. If you go home and you're feeling really terrible and you're having a really bad reaction, you will want to call 911 or go to the hospital. If you're feeling unwell and you have more questions, you can always call the clinic where you got your vaccine, or you can call your doctor. Just make sure that you let someone know that they can help you. So I've given you a brief overview of the visit and kind of what to expect. I'm going to pass the presentation on to Nigel Howard. He's an interpreter and a fabulous person from Canada. You will really enjoy his presentation. Thank you.
All righty then. Hello, everybody. I tried to click my camera and it was blocked. So no matter what I did, couldn't get it to turn on. Anyway, hello, everybody. So with Dr. McKee's explanations and Sarah's explanation, it's really important to take their advice. The vaccine is so important. So if you're on the fence right now, based on Dr. McKee's explanation, the vaccine, it's so different compared to how vaccines have been made throughout history. So whether you've gotten a vaccine before for like the flu, like the vaccines have had dead viruses or parts of the virus inside. What's different about this one is that there's mRNA. So again, maybe you're confused about what mRNA is. So protein, think of like a protein shake, that bodybuilders take. There's protein in the vaccine that carries the mRNA throughout your body. And your body is ready to fight against anything that comes in, whether it's the common cold or some other disease. Your body's always on the lookout for something that doesn't belong. So when the COVID-19 virus enters your system, because it's looking for a susceptible person, and it grabs onto parts of your body in your cells, that defense that your body wants to mount will have the vaccine to help protect it. So there were two vaccines, the Pfizer vaccine and the Moderna vaccine. So if your body is unsuspecting and the COVID vaccine or the COVID-19 virus gets in, it gets past your defense and your body's much weaker. With the vaccine, it sort of wakes up your immune system and it says, hey, do you see this shape of the virus? This is the kind of shape you need to be on the lookout for. And it tells your body to be aware because it's going to be dangerous for you. And so when the COVID-19 virus enters your body's already prepared to fight against it. Now, there are two shots you get as part of the vaccine dose. And it's important to remember, the first shot kind of wakes your immune system up. And so it helps your body to recognize the COVID-19 virus. But then after some time, your body will kind of get a little lax again. It'll get used to it. So the second shot is like a wake-up call. And it reminds your body to really be on full alert so that when the COVID-19 virus comes, your body's already set to mount a defense and get rid of it out of your system. So it's important that as many people as possible get the vaccine, because if they don't, then COVID-19 has more and more people that it's able to get sick. As Dr. McKee explained, if there were 10 people and most of the people have the vaccine, let's say maybe only 1 or 2 people don't have the vaccine, the virus doesn't have anywhere to go. There are no hosts, and so the virus itself withers. COVID can't enter into those systems because their COVID-19 is blocked. The virus is blocked, and so therefore the virus goes away. So keep in mind that the vaccine has a protein. That protein helps carry the mRNA that wakes up your body's immune system to be able to accurately identify and defend itself against COVID-19. It doesn't have any of the virus inside of it. It's completely safe. Do you remember getting a vaccine when you were, at any time when you were younger, right? And a nurse might give you a lollipop because they're trying to encourage you that it hurts, but it's good. Same thing, there's gonna be a little bit of pain at the site, but then it's going to go away. Some people, but very, very rarely will there be a more serious reaction. You'll have a period of time where you'll be observed, and then as your body has the vaccine in it, it's going to be able to bolster your immune system to be able to fight against the virus. So right now, the virus kind of has more power than it should because there are so many people who can get sick. But as more people get vaccinated, then we will be able to overcome the virus. It will have fewer hosts to be able to come in, and we'll be able to deal with this pandemic. In addition to washing your hands regularly, wearing a mask, and maintaining social distance. Because if we do that, in addition to being vaccinated, then the pandemic will begin to slow. And then we'll be able to slowly work our way back to normal life as we expected it, okay? So that's it for my part. Here he comes. Here's Dr. McKee. Hello. Okay, so now that we're all on screen here, I want to take a minute to answer some questions during a quick Q&A period. I've been looking through the list of questions as they've been posted, and it says, why not do a mix of Pfizer or Moderna, a mix of Pfizer and Moderna for the vaccine? For example, getting your first shot of the Pfizer vaccine and doing your follow-up shot as the Moderna vaccine. That could be something that is appropriate at a future date. But at this point in time, whichever vaccine you get, you should get that same vaccine company for your second shot. Whether or not they'll eventually be interchangeable, we'll see, because essentially they're using the same pathway with mRNA.
I can take the second question. I mentioned this in my part of the talk, but I can go over it again. So, some of the common side effects would be pain in this area where you get the injection, headache, feeling very tired. So those are the top 3 most common. You can also have fever and chills. You can have body ache. You can have swollen lymph nodes as well, but those are less common. I think I went over all of them.
So Nigel, do you want to go ahead and, so I'm looking at the list, you want to go ahead and talk about allergic reactions? Yes. So when you think about the 2 shots for the vaccine, it's, I mean, a logical question to say, why not get both shots right away? But remember that first shot is sort of alerting your body's immune system. It's the first time your body's being exposed to this mRNA. And so it's learning how to mount a defense against the virus. Because without the vaccine, your body has absolutely no idea to recognize it. And so it's very susceptible for the virus to enter into your body. So what that first vaccine does is it wakes up your body's immune system and it teaches your body how to recognize it, right? Think of going to school. Do you learn everything in one day? No, of course, it takes time for you to be able to have a mastery of any subject. And so there's 21 to 28 days from the first shot. Let's just come up with a fake timeline. So on February 1st, you get called to get your first shot of the vaccine. You go home, and after a period, 21 to 28 days, let's say 4 weeks later, you get called back in for the second shot. And by that time, your body's already more aware, prepared to recognize that virus. So with that second shot, you're even more immune. So it's very, very important to have those 2 shots at the appropriate timetable as well to really get your body to be as fully prepared as possible. Now, there's another question right now about variants. So the virus, COVID virus itself, has mutated a little bit. So the one that this question was particularly related to is B117. That's a variation that first appeared in England and now is spreading. So many states in America are now seeing this virus, including our area. And it seems as though, yes, it does come with it spreads faster. And that 6 feet of distance isn't quite enough anymore. It's much more contagious. But the vaccine will probably still be effective against it, which is a relief. So that variant, there's other variants across the country. There's South Africa, as well as Brazil, that are different variants of the virus. And they are unfortunately entering into the US. We're still studying these variants. about whether or not the vaccine will be effective against them, like for example, the one in South Africa and Brazil. But we do know that the vaccine will be helpful. Will it be that 95% effectiveness? Maybe not, maybe a little bit less. But still, the more diligent we are and the faster we're able to get the vaccine, the more we adhere to mask wearing, hand washing, and keeping our social distance, then we'll be able to protect ourselves against any variations and mutations in the virus. Sarah, do you want to take the next question?
Sure, I'll take the next question. So, the next question is asking if this vaccine is like the flu vaccine. We take the flu vaccine every fall, and we have to take it every year. So, what I've been told at my health system and from other people is we're not quite sure yet. Some people have said that this vaccine covered us for 6 months. Some people say that it covered us longer. So what I'm gonna say is we're kind of finding out things as we go. So we're learning new things every day about the vaccine. So just stay tuned to the websites that I mentioned. We're gonna have some resources that are posted as well. You can look at those. Just keep yourself updated and you will know more information.
Nigel, do you want to take the next one? Yeah. Well, before we do that, I want to make sure the comments section are going to be where we're posting those resources. If you were also interested in joining us for future Facebook Live events and some of the presentations we're going to have coming up, please register here. Spread the word for those people who don't know about these presentations. So, sorry to make that quick plug, Nigel, but over to you. Yeah, so the flu vaccine is an annual vaccine because the flu mutates and changes a little bit from year to year, right? So every time we build up our defense against it, flu will change to be able to be a little bit stronger against us the next time. And so we have to be able to fight against the flu by vaccinating ourselves every single year. But it seems as though COVID is different. Again, we mount our defense with the COVID-19 vaccine, but we won't know how long it will be an effective vaccine. It could be a couple of years, as Dr. McKee explained. They were able to find out that the first shot, whether or not they chose 100 people in each cohort, right? So those people who didn't actually get the vaccine, what they got was like a sugar water, right? They didn't get the actual vaccine. And so with that, they were able to prove that, yes, the vaccine was far more actually effective at protecting a person against the vaccine. So with those trials, we have 2 companies that were able to get approval for these emergency vaccines, which Pfizer and Moderna. So the flu virus is totally different than the COVID virus. The variation in South Africa and Brazil is a good example. Already the virus has mutated. Seems as though the vaccines that we have right now will still be effective. The ones that we were originally exposed to, the vaccine was developed against. And we're not sure because this new vaccine spreads so much faster and is able to be much more contagious. Okay, the next question would be, could getting the vaccine kill me, or could I have a serious allergic reaction? So again, it's rare to have a significant complication like that. It's very, very safe. Right now, it's 1 in 400,000 people have a severe allergic reaction to it. Think about how many people have died from COVID. the possibility of you having a severe reaction compared to those who have died from actually getting sick, obviously it shows that getting the vaccine is the much safer and smarter option. It's also important to make sure you're on that timetable of waiting the appropriate time between the first and second shot, and that you know that your body needs the full time to be able to build its defense. And during that time, even after you get the vaccine, if it's not that full 35 days for your body to build defense, you could still contract the virus. Many people have died because they've also contracted another virus, or they've had serious complications or different infections. The virus, the vaccine itself is safe. And when I'm working with patients, even though now that I have had the vaccine, I'm much more comfortable. It's best to do what you need to do to protect yourself and your family, which is the vaccine. Sarah, want to take the next one?
There was a question asking about when you get the vaccine, if you want to take the next day off. I tell my patients that come to the clinic to take the next day off because you don't know what kind of side effects you might have the next day. You might have nothing, or you might have all of them. So it's better to just take the day off, rest, and just relax. If you cannot take the day off, I recommend taking lots of water with you to work, and some Tylenol and ibuprofen, just in case you get a fever, headache, or body ache. Just be prepared.
Nigel, do you want to go ahead and take the next one? Yeah. Think of it like when you go to the gym, right? After a gym day, your body's a little sore because it's not used to working that hard, especially if you haven't been to the gym in 15 years, right? If you decide that you have a good day and you want to go work out as best you can, the next day you're really going to feel it. I mean, that's not the exact same severity, but what it's going to take is your body is going to take a few days for it to get used to this workout that it's going through, just like your muscles would take a few days to get used to a physical workout. So again, thinking that you could have both shots and just be done with it won't be effective. That first shot wakes your body up. Let's bring it back to the flu. What that flu vaccine does is it alerts your body so that it's ready to recognize the flu virus when it comes in. Without that, you would be sick. You recall being sick where you're home feeling very bad, and your family may be taking care of you and giving you soup. But then as your body begins to build its defense and you start to feel better, maybe four days later, you're going to feel so much better. Now, if we take that to COVID, your body is not able to recognize the COVID-19 virus right now. So what that first shot does is it makes it so that your body's aware and starts to mount that defense. If you do both shots back to back without the appropriate timetable, you're going to overwhelm your body. Your body needs time to learn, to be able to take the dose in appropriate amounts to be able to build up your immunity. And like Dr. McKee said, it might take 35 days, up to 35 days, depending on whether or not you have the Moderna or the Pfizer vaccine, for your body to be fully prepared. And after that second shot, so whatever your healthcare provider tells you in terms of timing for the first and second shot of the vaccine, follow it. And don't put off the second shot. Make sure that you stay on that timetable to really help your body be prepared. Another example would be like, if you have other people in your family with health issues or like diabetes, and you think that you're fine and you contract the virus, you bring that home and you spread it to your family. And maybe their bodies, because they're even weaker, will be able to have, would have a much more serious reaction to that. Then they would have to go through the rigorous healthcare, they would have to go through all the health medical attention that they need and hopefully pull through. Or if they're going through another infection or they're fighting another virus, and then you compound that by bringing COVID-19 into the situation. Or don't spread it to your family and friends. Really be vigilant with mask wearing and social distancing and cleaning your hands. And do not go out and be in large crowds. Follow the advice of the public health officials. When they make adjustments to what's appropriate for the public, follow those adjustments. Because just like Dr. McKee, they have training and expertise in knowing what to do. And if you follow those directions, you really, really will be saving lives. I mean, US is one of the worst rates of death in the world, over 400,000. It is not something to take lightly. So many times people didn't realize that they were sick, that they had the virus. If you feel like you're sick, even if you think it's just a cold, stay home, protect yourself, protect those around you. Wow, really think of that statistic, 400,000 deaths. Follow the health experts, please do your part. Thank you, Nigel. The other question that we had was, well, we've answered those. Will there be new vaccines coming? So I talked a bit in my part that there was emergency approval for the 2 vaccines that we have now. Johnson & Johnson is currently working, another one of the large companies that's currently working on a vaccine. Theirs is a 1 dose, but we don't know how effective it is. They're still waiting on trial. But we should know more about their vaccine in a few months. And other vaccines will be coming out as well. There are many countries that are working on the vaccine. The 2 that we're talking about are just approved in the US. The other thing is, if you feel like you've got some pain at the side after your shot, if you can handle it, don't take Tylenol or ibuprofen right away. If you're in a lot of pain, that might be fine. But really, you want your body to go through what it needs to go through to build up its defense. So if you can't tolerate whatever feelings you're going through, go ahead and take an ibuprofen. That's not going to ruin anything, but it is going to mitigate. It's going to make it so it's less effective. So, and also don't skip your second shot. Sarah, back to you.
There is a question where someone asked, what if I have COVID-19 and I don't know? Should I go ahead and get the shot? So my best advice in that situation is probably to go get a COVID test to see if you have COVID-19 or not. That way you will know if you have it or you don't. We are recommending people that have COVID-19 and they've tested positive not to come to the clinic. Obviously, because they don't want to expose the healthcare workers or other patients that come to the clinic. So we would ask those people that test positive to wait until they're negative. If you've had COVID-19 in the past and you test negative, you can get the vaccine. However, when we ask you your question, when we're taking your health history, there's 2 questions that they might ask you. They might ask you if you have monoclonal antibodies or if you have plasma to treat the COVID-19. if you've had those in the past 90 days, then we will respectfully ask you to wait. I'm not gonna get more into that because that's a very detailed thing to go over. We can probably talk about that in another talk.
Good. Yep. So our next question is related to pregnancy. So if you're pregnant, can you get the vaccine? First, it's important to talk with your OBGYN or your primary care doctor. We are encouraging pregnant women to get the vaccine. We don't have any data to show whether anything other than our knowledge that if you contract the virus, it can be quite serious during pregnancy. Do moms who get sick with COVID-19 die? If you are serious enough to go to the ICU, 80% of those people are on breathing machines, and the babies as well suffer. So again, it's a balancing act. If you're pregnant and you're able to get the vaccine, I do recommend you get it, and we'll be following up on that as it goes along. Sarah, Nigel, I don't know who wants to take the next question. Nigel? So going back to, if you feel off, if you feel sick, get a test. Make sure. So COVID has a 14-day period, right, where it could be in your system and you're still spreading the virus, whether you're yelling or singing, right? When you're opening your mouth and engaging with the air around you and the virus enters into your system. For example, church has been a place where it's been able to spread. As people have been singing in church, the virus is in the air, and then you're able to contract the virus. So it's important to make sure that you're following strict rules about what, maximum capacity for people, or wearing your mask in a building. So in Canada, religious services are not happening the same way as they used to. There might be 25 people in a building where there used to be 400. And then after a certain point, they decided that they just weren't safe at all right now because of the virus hanging around in the air. But going back to, like, if you were to contract the virus, say Monday, it might take 4 or 5 days for your body to register. And as soon as you feel something off, go get tested. Or if you've been in a public place where you shouldn't have been, to be honest, but let's say you were and you're starting to get concerned about whether or not you were exposed, go get tested. That way you're able to see whether or not you have contracted the virus and you need to isolate yourself, or talk with your doctor and go through all of the health recommendations that you should be doing. One of the biggest ways to really help against the COVID virus is to not be in large crowds. What's great about sign language is you can be very distant, right? You don't have to sit side by side. You can be further apart. A lot of our senior citizens will go to a shopping mall and they'll sit in lawn chairs out in the parking lot, and they'll sit very far apart. It's important not to be close because that increases your odds of contracting the virus. So if you've been around somebody where you're concerned, get tested, whether it's saliva tested or the nasal swab. Sometimes, I don't know with the state of Michigan how it looks, but Sarah, do you want to go ahead and talk about getting testing?
Oh, I can talk about getting tested. I've actually done swabs on people. It's not comfortable. I will warn you that. Well, I absolutely recommend that you get tested if you feel sick and you want to be safe and you have elderly family members or people that are immunocompromised. Please go to your health department or any other testing site and go get tested as soon as possible. It gives you a peace of mind to know if you have COVID or not. I want to wrap up with the last question that we can answer because we're running out of time. And that is the big question that everybody's asking. How do I sign up to get my vaccine? My biggest answer for that question is to ask your doctor, because usually your doctor is in something called a health system. So Dr. McKee is in Michigan Medicine. I work for Henry Ford. So your doctor may have more information on where you can sign up. Sometimes it's through an online portal like MySearch, or sometimes you can make a phone call to the clinic where they will do the vaccine. So the best place to start is asking your doctor. Another way that you can sign up is to contact your local health department. So if you live in Oakland County, you call the Oakland County Health Department and they can help you sign up for it. And I am going to pass this back to Mike and he'll close this talk tonight.
Thank you, Sarah. Thank you to both of you. You did a great job really giving us all the details. Thank you to our audience who joined us tonight. Please share our Deaf Health Talks and let's work together to really overcome this pandemic. Do what you can. Get vaccinated. And don't forget, wash your hands, mask up, be socially distant, okay? Thank you, everyone. Thank you to my team, and good night. Good night, everybody. Whew.
Hi, I put in a lot of the pre-planned comments. I hope everyone saw, but we got so many people. 400 were joined live, so yeah.
Congratulations, everybody. Wow, that's great.
Also, everyone really loved you, Nigel. We got so many comments that you're amazing. That all of you are amazing.
Oh, yeah, I totally get it. Oh, that's so nice. He's a star. He really is. Nigel's a star. I was so glad we were able to recruit him for this presentation. Hopefully we'll get him to come back. I am honored. Thank you very much. Listen, you guys have a great team. Really, it's the team. 2,400. Wow.
Wow.
Woo! We need to be able to share, right? So again, more people are going to watch it because they're going to watch it afterwards. So again, thanks to all of you. We'll keep working on the schedule as we go along. So we'll do our best, work together, okay?
Good. Thank you.
Okay, everyone's ready to go to bed now, I bet. Not me. Not quite. Not for once. I'm not going to bed. I've been interpreting until 2 o'clock, 3 o'clock, sometimes 4 o'clock in the morning because I've been doing some jobs in Europe. And so I'm on their schedule. So for once, I can be on British Columbia time and I don't have to stay up. All right, thanks everybody. Thank you also to the interpreter.
Okay, good night.